people's lives are affected by cancer each year. Now, cancer is a very generalized term because it comes in many different types and levels of risk. Specifically, ALL leukemia is found most common in children, and unfortunately the cause of it is still unknown, so there is no real way in order to prevent this disease from happening. If a child is diagnosed with ALL leukemia, there are many steps involved to help get rid of this disease. It takes a physical and emotional toll on the one experiencing it, and one can only hope that the treatment involved is a success. A day at the park is where I first began to show symptoms of ALL leukemia. My mother had noticed that I was unable to keep myself from falling down. Now, general symptoms include fatigue, weight loss, fever, and loss of appetite, along with night sweats. Most of these symptoms develop from a shortage of normal blood cells. And why this happens is because leukemia cells crowd out normal blood-making cells in the bone marrow that causes the shortage. Another common symptom is swelling in the abdomen, and that is caused by cells that build up in the spleen or liver, which causes them to enlarge. Another symptom that I began to show were lymph nodes. Now, what lymph nodes are bumps underneath the skin that spread close to the surface of the body in areas such as the neck, groin, or underarms. And although these general symptoms may imply that a child has ALL leukemia, further testing is needed in order to be sure. Now, the doctor is going to want to know all medical history of the patient. And a physical exam is also going to be done that consists of things like checking for bruising or bleeding, infection, swelling of the abdomen, and the bone marrow. Test samples from the blood and bone marrow are also going to be done. According to the American Cancer Society, complete blood count, or CBC, measures the numbers of red blood cells, white blood cells, and platelets. Now, when I received this test, my white blood cell count appeared to be very low, and it turns out the reason I was falling down at the park that day was because of a tumor that was in my hip. I was 3 years old when the doctor came in and delivered the news that I was diagnosed with ALL leukemia, and treatment became the next step in this process. I received chemotherapy, which is a number of drugs that travel through the bloodstream throughout the body to reach cancer cells. I was delivered chemotherapy in 4 ways, through spinals, through IM, IV, and orally. The IV was hooked up and ran through my chest and was the most frequent way I received chemotherapy. Now, chemotherapy generally lasts about 2 years, but because of my rare case of ALL leukemia, it lasted closer to 3. Now, although chemotherapy travels through the bloodstream, it is unable to be transported through to all parts of the body. According to the American Cancer Society, most chemo doesn't reach around the area around the brain and spinal cord well, so it may need to be injected into the cerebral spinal fluid to kill cancer cells in that area. The term for this is called intrathecal chemo, and it is performed by a lumbar puncture and what was known to me as a spinal. It was definitely my least favorite way of receiving chemotherapy because of how painful it was. Now, chemotherapy comes along with its own symptoms as well. The most visually obvious one is hair loss. I began to lose my hair in patches, and my mom decided to avoid the inevitable and shave the remaining hair off, which most patients end up doing. Other symptoms include mouth sores, loss of appetite, and easy bruising or bleeding. Now, chemotherapy, although very necessary, is very costly on the body because chemo cannot tell the difference between healthy cells or cancer cells. So healthy cells are also destroyed in the process, which leaves the immune system very weak and very vulnerable. Now, chemotherapy affects blood cells that protect against disease and germs. According to the American Cancer Society, as a result, your body cannot fight infection, foreign substances, and diseases as well as a healthy person's body can. So the average person can get away with certain actions throughout the day because of a healthy immune system, but a cancer patient can't afford to take such risks. So there are precautions that they need to take in order to ensure that the immune system is protected further. Such actions include frequent washing of the hands, washing fruits and vegetables, and wearing a surgical mask to block out any substances from entering the body. There were times during this whole process where the road to remission seemed non-existent, but after 2.5 years of chemotherapy, I was cancer-free at last. Now, it's an unfortunate circumstance for anyone who is diagnosed with cancer because it is sometimes a battle that is lost and won. And one can only hope that the patient that's undergoing treatment can control the cancer and it can lead them to remission.